Hi, I'm Rodney A. Brooks. Welcome to RodneyABrooks.com. Today we're talking with Lisa Humes, a licensed insurance agent, and we're going to talk to Lisa about all things Medicare. Welcome, Lisa.
Thank you very much. It's great to be here. I appreciate the invitation.
Well, let's start with basics with Medicare. It's Part A, Part B, and then Part D, and then something we call Part C, which is Medicare Advantage plans.
Right.
Okay, let's do a short description of what each one of those is.
Okay. So for Medicare Part A, that's the one that covers hospitalization, skilled nursing, and hospice care, government sponsored, and typically it's at zero premium to the person who's enrolled in it, as long as they've worked in the U.S. for 10 years or more full-time and paid into the system. It comes at zero premium. The Part B is the one that helps out with doctor visits, lab, x-ray, physical therapy, and durable medical equipment. That one does come at a premium. And this year in 2022 is $170.10. The new numbers just came out and were published, and it's actually going down to just under $165 next year. Now that is the base rate. There are some additional costs if you either have a late enrollment penalty or if you're considered a high wage income earner. There's what's called IRMAA, I-R-M-A-A, or income related monthly adjusted amounts that can raise that rate. But Part A, Part B are the government sponsored program, and they do not cover prescription drugs. That's what Part D is for. Covers prescription drugs, and that's always through a private insurance company, but they have to be able to be certified through the government and abide by their rules. So it is through private companies that you obtain prescription coverage. The last one that you mentioned, Medicare Advantage, works a little bit differently. So Medicare Advantage basically takes over for the services of Medicare, takes over for your hospitalization and doctor visits. Generally, it can add in prescription coverage, and it can add in some extra things like dental, vision, and that sort of thing. Those plans are, again, through private insurance companies. They are more localized in nature, so it depends upon your zip code where you live, what plans are available to you. And you still have to maintain your Medicare Part A and B, meaning you have to pay that Part B premium. What happens with the premium money that you're paying? The federal government turns around and subsidizes those companies on the back end to help them with the claims and administration. So you don't use your Medicare card any longer. You're only using that Medicare Advantage card, but you still have to maintain the monthly premiums for Part B.
Now, one of the keys, I think you said local, one of the disadvantages is your doctor may not be included in the Medicare Advantage.
Very
plan,
good
correct?
point. So
Yes.
networks are different. If we could kind of compare those two things with Medicare Part A and B, and perhaps a supplement, those things work the same whether you are in DC or Texas or Washington State. So your primary network is Medicare, and Medicare would be the only thing you have to worry about to a new provider or hospital. Do they participate? And if they do, of course, you're covered. With Medicare Advantage, because you're partnering with a private company, you're now using their networks, and you use their network of providers to get all of your services. If you go outside that network, if you have an HMO, you pay the entire bill. If you have a PPO, you may have a deductible and then a higher cost for care. But typically you have options to go in or out of network if you have the PPO version.